Let's speak now to a Professor of Public Health. He's also the Acting Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. I'm talking, of course, about Professor Mosa Moshabela. Professor Moshabela, good evening to you and thank you for your time. I realize making predictions ahead of these things is very difficult. There will have been consultation with the National Coronavirus Command Council. Cabinet was due to meet today. Presumably, though, there will be some restrictions ahead of the long weekend and then the school holidays.
Yes, greetings to you, Stephen, and to your viewers. Indeed, I think from my end, I must say that I am very pleased to see the level of engagement with the potential risk of a third wave, especially given the fact that our vaccine rollout has been delayed. So we need to go back to the mechanisms, methods, tools that we already know. And I mean, there's none other better than, putting in place some restrictions at a time when there is potentially risk of triggering infections. So I'm very pleased with the discussions. Yes, we may not predict exactly what would happen, but the fact that there's so much engagement and so much effort, for me, that goes a long way.
Obviously, we don't know what's going to happen, but at the moment, the number of new cases are still relatively low, and that'll lead to the question, why do we then need new restrictions if the number of new cases every day is still so low?
Yeah, absolutely. And I think it's the concept of prevention. It's very difficult for us in South Africa to engage with the notion of prevention because we are used to a reactive response. But if you think about the devastation that we went through with the second wave and the amount of harm and damage that it caused because we responded late, and we were reactive instead of, kind of proactive, then we ended up with a lot of harm. Clearly, nobody wants to see that again. We all want to prevent that, which is why we are saying, what is it that we can do to limit the risk of a third wave resurgence? Even if it does occur, make sure that we keep infections as low as possible by eliminating those risk factors that we know drive infections. And even if those infections increase, how do we keep those infections low over an extended period of time while we are at the same time figuring out ways to get people vaccinated? This is really what we are saying. And if we do that, then we will limit the number of people who are admitted to hospital, limit people who potentially could demise from COVID-19 infections. And that will then help us to see to have a better experience than we saw with the second wave. It's a prevention, it's a concept of prevention rather than reaction.
Is it possible to say which is more important, a ban on large public gatherings, so more restrictions there, or a ban on travel? And I say this because before the pandemic, so if we go back to 2019, more people moved around over Easter than did actually over the Christmas period. It's an astonishing number. You saw that with road traffic accidents as well. But it's 2 days. I mean, it's Tuesday night tonight. If you're going somewhere for the Easter holiday, you're leaving on Thursday morning.
Yeah, I think in my view, I think that this year we are in a much better state than we were last year Easter, because last year Easter there was a lot of panic and people really didn't understand and people didn't have enough knowledge. We have a lot more experience and we have to leverage the experience that we have. So even people who are making decisions, they don't need to panic. They just need to trust that most South Africans understand what they need to do and the importance of prevention measures. And because of that context, then I can say that we can confidently say that travel, as long as it is not in groups and clustered, may not be as risky as gatherings. Gatherings are definitely going to be more risky. I do want to say, though, that, the point that was just mentioned now by the CIC of EFF, that, we need to consider alcohol. If travel is linked to alcohol, then you might find that travel can be risky. But if you now just traveling for holiday to go see family in your bubble and so forth, that I think South Africans have enough experience to know how to navigate with masks, with adequate distancing. When they get into shops, there are hand sanitizers. The mechanisms have been put in place, Stephen, and I think that we can definitely trust South Africans to play their part. But the gatherings are the ones that we need to watch out for. In general, I would say that, we need to always make sure that we don't look at one thing, that will solve all the problems, but we think about the combination of things that can basically help us solve most of our problems.
And you know, Professor, where this all takes us, of course, is do we need to have a complete ban on the sale of alcohol? It is the contentious issue. It's the issue that is likely to see lawyers arguing about this in Latin over beer. Can't wait for that. Do you expect there to be a ban on the sale of alcohol?
Yeah, I do expect that there will be restrictions. I don't think that, the government will ban alcohol completely, but I certainly think that there will be restrictions. I've also looked at the recommendations by the South African Medical Research Council in terms of restricting alcohol, and they're also not proposing a complete ban. So, and I support that. I think that, again, here it's about also trusting each other, trusting that people understand the importance of this. So I would really also support restrictions, but not complete ban.
Professor Mosa Moshabela, as always, I really appreciate the time. Thanks very much indeed. Professor of Public Health, Acting Professor of Research and Innovation at the University of KwaZulu-Natal. Well,